Hi, I'm Dr. Navdeep. Today I'd like to talk about Polycystic Ovarian Syndrome, also called as PCOS. This is a very common disorder seen among doctors in patients in their reproductive age group. They come in with many symptoms, example, irregular cycles, heavy bleeding, excessive growth of hair in their body. At times they have no periods at all, amenorrhea, and commonly infertility. So a lot of patients ask me about the causes. Why do I get this? We don't know for sure. There are many postulated ideas about why this has occurred. Mainly maybe genetic problems where you may have been born with it, or it can also be due to something called insulin resistance, where your body is unable to use the sugars efficiently, but it's commonly associated with obesity. Now, how do you diagnose polycystic ovarian syndrome? There are three main things. Number one, they have increase in male hormones known as androgens, and that is the one that causes them to have an irregular cycle or even excessive growth of hair. Secondly, they have an irregular cycle where at times no period for more than 6 months, 12 months, or no periods at all. And thirdly, upon doing an ultrasound scan for them, you can note that the ovaries have many small cyst-like or fluid-like sacs in the ovaries, which is basically lots of immature eggs in the ovaries, which do not ovulate. Hence, they do not get a regular cycle, and that will contribute to infertility. There are many advice and treatment options that we give these patients. Firstly, lose weight. Stop the sugar, or rather reduce sugar and their carb intake. By doing this, then they can reduce weight. And it's noted that if you lose 10% of your body weight, most women have been noted to have a regular cycle, and some even conceive naturally after that. Exercise is an important factor here because that will help you to burn your calories and make you healthier. The other treatment options would be depending on what symptoms the patient comes with, or what does she want. Does she want a regular cycle? And then we'll prescribe her a course of birth control pills. Well, that will make the cycle more regular and more predictable. Secondly, if they come for fertility issues, then we may start them on pills to help them grow their eggs. An important factor here too is Metformin. Metformin will help your body use your sugar more efficiently, and when you use your sugar more efficiently, then you eventually will reduce weight too. And with Metformin alone, lots of women have lost weight and eventually conceived naturally. Now, coming to eggs, growing of eggs, we give them an ovulation induction medication called clomiphene citrate. We can try this 3 to 6 months. If it's not successful, then we'll go on to follicular stimulating hormone injections. Now, these injections are also to grow eggs. In women who have failed the medical treatment, then we'll opt for surgical options. It's known as laparoscopic ovarian drilling. Now, this is done under anesthesia, where we'll do the keyhole method of surgery, where we make holes into their ovaries. By doing this, patients can have a regular cycle and even within 3 to 6 months conceive naturally. But after that, if they still don't conceive, then you need to look into other methods, for example, in vitro fertilisation or IVF treatment, commonly called as test tube babies. The bottom line here is that polycystic ovarian syndrome is potentially treatable. That means we can help you to have a regular cycle and eventually to have babies, either by tablets or even surgical methods or IVF. If you need to know more about polycystic ovarian syndrome, please drop me a message. I'll be happy to reply you as soon as I can. Thank you.